So here we are again. I'm with your favourite midwife, Margaret Mary. So they tell me.
Yeah, someone likes me.
Yeah, somebody.
There's a couple.
There's a couple out there.
Yeah.
And just following from the last podcast that we've done, and hopefully people have listened to the previous one, which is a very generic sort of thing about childbirth and labour and all those sort of things. The dreaded scales. In your room,
I know.
And the women often come in and
say she's mean.
And make you put them on the scales just to make them feel better about
They
themselves.
probably don't have to go on the scales, do they?
No.
Probably about 60% want to.
Yeah.
Because I think most of them are some girls are particularly keen on just putting on a reasonable amount. 10 to 15 kilos is pretty much what
Normal.
I say.
That's right. Exactly.
Small girls, you might go 10. Amazon girls, you might go 20, but in between there. But some girls are extremely particular about a few hundred grams.
Well, often I come in and they're in a state of undress, trying to get lighter and lighter. So,
That's
so
right.
the
Trinkets
bag,
come off,
everything's coming off. And
Yeah.
I don't think those clothes weigh as much as you think
No.
they do.
No, I don't think
I've
they do.
tried it myself.
Thongs, it's amazing how much.
Look, I often know that if you go to the toilet, you think you're going to lose weight, but you don't.
You don't know. Do a 300 ml wee, I'm sure, and not scary.
It's pretty stable, I think, in many ways.
Right.
But yeah.
But think about where the weight goes, though.
Oh yeah, look,
The baby,
Yeah.
the uterus, increased circulating volume.
Yeah, there's about at least 1.5 kilos just in blood, and that's in the first few weeks of pregnancy. And then obviously the breasts.
The breasts grow. Yeah, they grow.
Maybe 1 kilo in total for the breasts.
For some lucky girls, yeah.
And then that's right.
Yeah.
For some of them, and then the rest is on your bum.
No, wait a minute.
Oh,
Wait
sorry.
a minute.
Oh,
The uterus. There's a placenta.
Oh, sorry.
There's liquor.
Sorry, yeah.
There's just a little tiny bit in case there's a famine afterwards.
On the bum and thighs.
Bum and thighs, yeah.
Most of it goes back to normal. Unfortunately, the breasts go back as well.
They do. Yes.
And
So take photos because they won't laugh.
No, that's right.
No Dolly Partons.
I was like this once. I've got a few of
Yeah.
those from when I was 18.
Yeah.
And it's all been downhill since.
Yeah,
so.
yeah, exactly. Yeah.
But no, it is. I think there's a huge change in your body image. I think
and you change your shape. Like I think, definitely breasts.
Yeah.
But unfortunately, they're tender as well.
Yeah.
But the shape, I think, if the baby grows out this way, the guts have got to go somewhere, so they go sideways.
That's right.
So you don't have that curvy shape. You're just straight shape.
Do you think there's a major problem with body perception in pregnancy? Do you think a lot of people worry about this?
Oh, yes.
Really? Yeah.
A lot of girls, I think they're happy to go a little bit here and a little bit there, but they don't want to put weight on anywhere else.
Right.
Other girls embrace the gorgeousness, and I love seeing the girls coming in the tight dresses, and they just look fantastic. And even the girls who are bigger girls, I think if you can embrace the pregnancy and allow your body to do what it's got to do within obviously healthy range, eat well. You don't want to just cut loose because you can, because you're eating for two, because that poor little thing in there is quite happily just sucking it out of you. You don't have to eat another Mars bar to go with it. So I think keep healthy.
Yeah.
And just embrace your body as it is.
Yeah, I think so we get a lot of people who exercise a lot. We have the weight trainers, come in, the
athletes.
bodybuilders and stuff like that. But I think just general exercise is important. And I think the main things are Pilates and yoga. I like both of those.
I love both of those.
And I think it gives you good core strength. And
walking just for general, cardiovascular. Yeah.
Exactly.
Yeah.
So I think there's a lot of change that occurred, and when you get to about 28, 30 weeks, it becomes more difficult to do those sort of things. But
Ligaments are pulling, big stretchy walks. Ligaments pull, your pelvis pulls, twangs here and there, and pressure.
God, why would you do it? Anyway,
I'd have done it again.
They do say if men were to have babies, they'd only have one.
Only have one and think, what the hell?
Was that?
Never doing that again. Yeah.
I'll never get back to normal. But I do see them 6 weeks and 3 months, even years later, and they all go back to
they do.
looking their normal
But
size.
it takes a while.
It does take a long time.
They say the breastfeeding, yes, it can get the weight off, but the minute you stop breastfeeding or you go back to normal, then I can tell you now, you just. I think you're not as fit. Not all girls are as fit. You're running around after a toddler.
Yeah.
And I think the main thing is when you're...
Here I am sucking in.
I know, I'm just thinking that. I think, don't worry, what are you looking at? But anyway.
I'm just sucking in.
When you got the toddler. But, you prepare food for the toddler. So any leftover, you go, girls, that's a really
I used to do that
thing.
all the time with the kids.
I know, it's easy.
And sometimes they would have these little sausages, and I'll just
One
go,
for you.
please, but I just go, please don't finish that, because you just so wanted to polish it off,
And it's you shouldn't, but It's human nature.
I think that's probably why I never lost the weight
delicious.
afterwards, actually. Donna lost the weight, obviously. I didn't. And, I just went bald and fat. So, yeah, great.
Sad, really.
Yeah, it is very sad. Wait till grandchildren, I'll be huge.
Oh, they'll love you a bit. Oh, there's that roly-poly.
That's right. But, yeah, no, I think there's a big perception, with, when you look at people on TV, who are pregnant, and they come out after having their babies, they're this tight as you like, and they look fantastic. These beautiful women coming out.
Skin looks fantastic. How much Photoshop must they do?
Oh, there's some serious airbrushing going on there.
Oh, there'd have to be. And the abdomens look. I just think let the body. How long does it take? It takes more than 6 weeks.
Yeah, oh God, it takes up to a year to get back to your normal self.
Exactly,
So all those changes, all those little niggly things, they rapidly get better within 3 months. And then 6 months, and then a year. What you're left with in a year, you're left with.
Yeah.
So you're gonna have to work on that to try and change that. So.
Just women are hard on themselves.
They are. Women aren't just hard on themselves. They're hard. Women are hard on other women.
Well, it's exactly right.
Do you know? This is the thing. Guys don't do that. They don't go, "Oh, you're getting a bit podgy there, mate."
Yeah.
We wouldn't say that.
Shaving that head or that this or that.
That's right. But women are so critical of other women. It's a real shame. And having 2 daughters, it's tough because I know what they're in for, and women are more critical of other women than men are of women.
But why is that? Is that because their expectation is, this is how I am, so you should be like that, or she's like that, I should be like her?
I don't know. To be honest with you, you get what you're given in life, and
I know.
you
I
work
love what
with
you
it.
are. Look at me, hot as.
Oh my God, delusional.
Some people are
Stop
delusional.
smoking those drugs, Margaret Mary. But no, I think there's a lot of people put a lot of pressure on each other. They all want to be like their friends or that friend who came back, and it makes them sick that they look so good.
I know. And there's very few.
There are very few.
Most of us are just regular girls.
That's right.
With an extra bit of weight or a bit of a saggy skin or stretch marks or.
And you hope that woman pushing that pram is a nanny because they look so good.
And she probably is.
Yeah, but they aren't. They're probably some, but it's very unusual for people to bounce back so quickly, and
embrace who you are.
Exactly.
Embrace what you've done. That's what I think. It just, what your body's just made a person.
Yeah.
Like embrace that and don't put so much pressure on yourself to look like somebody else when that baby doesn't care what you look like.
No.
That baby just wants you to love it and look after it. Like it doesn't.
Nice. I'm almost crying. Very touchy there.
Yeah, but it's true.
No, it is true. Hey, look, it is true.
Kids don't judge their parents on fat or skinny.
And that's right. I think people come in, and especially postnatally, they think we're judging them.
Yeah.
And we're so not.
I couldn't care.
We're the least judgmental people in the world, because we live in glass houses.
That's right.
So,
And I asked the girls, how many outfits did you have to choose from before you decided which one? And I hear back, well, he had that one really gorgeous one, but then, pooped all over that one. So I had to go, this is the second choice.
Exactly.
Who cares?
No, it doesn't matter. It doesn't matter,
And,
it's hard work being a mother, the first few weeks, certainly the first few. And it's probably the most, the job that people don't appreciate the most, because it is so hard.
It's unrewarding. You get not much back from the baby for 5 or 6 weeks.
Exactly.
And when you get those smiles, it's sort of like, it's worth it.
And to be honest with you, that gets better with time and with life. And, although they give you...
teenagers.
Yeah, well, yeah. Well, you're past that teenager stage.
I'm past that teenager. Now I've got youth.
Yeah.
No, no.
How's youth? I'm not saying. I'm sure he is. I'm sure he's never stepped over the mark.
No, lovely boy.
But yeah, no, same with my kids.
Anyway, they never step over the mark. No.
Never.
As a perfect.
They believe everything I say, my kids. They never ever argue with me.
No,
They
never.
listen to every word I say.
Yeah.
Because,
and go, yeah,
I know
Dad's
best.
got no idea, right?
I often hear Mela and Hallie saying, "Dad, you know best."
Yeah.
I'm sure there isn't any...
Was that in your dreams?
Yeah, probably. I think there's a bit of sarcasm probably in there.
Probably,
but they seem to know better than me at the moment. So anyway, that's all good.
And all of these little babies will be the same with their mamas. Yeah.
Yes, that's right. And they are. And I wouldn't have it any other way, though,
No.
But yes, I think body image is a huge thing.
Body image is huge. Stay away from magazines.
And social media out there. And people Facebooking, putting things on Facebook.
And their little, what are those, the mothers' forums? Like, they're fantastic for bits of information, but really...
Yeah.
like, decipher what's actually true and what's just bullshit.
There's a lot of bullshit out there, and there's, a lot of people bigging themselves up a little bit as well. And look, I'm sure a lot more airbrushing goes on. And I've got programs on Instagram now.
Feed yourself.
So I just joined Instagram to look at.
Can you make this all beautiful?
Yeah, but you can actually change things on yourself to make yourself look beautiful. I tell you, I've got a great six-pack.
I've seen those ones where you do those little devil's horns. They're the only ones I know.
But following on from our last podcast, we were talking about hypnobirthing, and we never actually talked about pain relief in labour.
Other sorts of pain relief, yes.
And and what is available to women when they come into labour,
So from my point of view, there's all those gorgeous natural things. So apart from using just yourself, your own sort of mental capacity of just relaxation, just breathing, movement, and people say in labour, breathe, just breathe. I don't freaking breathe. It's just breathing in a rhythmical fashion and not hyperventilating, basically.
Yeah.
And then sometimes they need assistance. So we can offer all other things, just like using the bath, using the pool, using birth ball, changing position, rocking, massage, heat, all of those kind of things. Then sometimes, obviously, as we know, medication's required. Very occasionally, pethidine. It's not used very often now, is it? But just
I use it sometimes. I use it for, certainly early on in labour.
There's a place for it.
And if they're just not dilating well and they just don't want an epidural yet, and they need something to relax them a bit more. Pethidine
just got to get them over the edge.
It just takes the edge off. It doesn't
last long.
No, but it just takes the edge off.
Don't ever anyone expect it for a whole labour, but it can just do the job. Or right at the very end, for that last half hour or something, where some girls just kind of just lose it. And those ones, it's if you can't sort of reel them back in and sort of get them focused, sometimes you just need a little something just to get them over the edge. But otherwise, the TENS machine, occasionally some girls have used a TENS machine, trans-electrical nerve stimulation. They can be effective. I've found years ago a lot of girls use them, up to about 6 or 7 centimetres in primips, or girls who've had a first baby, but they need to have used it beforehand. You need to know what you're feeling because it's bizarre. It's like little ants under your skin.
Oh, is it?
Yeah, it's weird.
I've never used one.
No, and it's like you just put these little pads on, and it's just this little subtle zzz, like that little ant.
I actually use one to make my stomach muscles twitch.
You need a really big one. So and then you can press it, and it zings harder when you have the contraction. So it builds it up, and so you get this. And I think it tells your brain a different message.
Okay.
So you sort of get this, then you get zzz, like that, and so when you have the contraction, it tells your brain, there's ants under your skin, as opposed to your uterus is contracting, and so it can be really good.
So it's almost like a diversion therapy.
It is a bit, or your brain and telling your brain a different story. So that can be effective. Nitrous can be really effective if it's used properly, so using the gas effectively. And I do get disturbed when girls will say, well, there's the gas, use it. It's like, here's the gas, let me show you how to use it. Because if it's used properly, you start really slowly, build yourself up ever so slowly, rather than just kind of starting in at a good strength, then you can get kind of really spaced with it. It can make you a little bit lightheaded, make you a little bit dizzy. So be in a pattern with your breathing, nice slow breathing, then get into using the gas and using it slowly, really, really low level, so that you don't sort of spin out. I think when you're exhaling because it works quite, quickly, within a few breaths you're getting some effect. As soon as you take it off, about 2 breaths later it's all gone. But you still feel a bit spinny, so I always say to girls, shut your eyes afterwards and just kind of get back into your rhythm again, and then sort of open carefully and look around. So
some girls say some funny things when they're
laughing gas.
With the gas, it's quite amusing. It's definitely worth a try, for a bit.
I think it can work, and some girls it can work beautifully.
Some people find they get a bit sick with it though, and things like that.
Yeah, and I think that's a little bit from hyperventilating, using it too much, and then opening their eyes and looking around, and then I think they spin out a bit, a bit. Whether it's like a motion sickness kind of a thing, like the whole brain's like holy dooly, and you get a bit nauseous from that. I don't know, maybe not. But I've seen girls using it in the bath and just using the water, having the relaxation from the water as well as the gas. They can work well. But then sometimes it's the epidural.
Yeah, absolutely.
And the epidural can be very effective.
Yeah, it's very effective, and it can be very effective.
Yeah.
But you can also get those windows which make it almost worse, because you get a block.
A patch might be here, or a bit of leg, or
that patch is so intense.
Yeah,
it can be.
And that's just from her own anatomy, isn't it? Just from a bit of nerve going some wrong way that's not getting the bathing of the epidural product. Yeah. But all of those can be fantastically effective. All of those appropriate for some people.
Yeah, absolutely.
Yeah, so don't let anyone tell you one or the other.
No,
don't you reckon? And don't whip yourself. And don't. I say to girls, if you need it, you have it.
Exactly.
Because if you wait until you're 7, no one's going to go to you at preschool, when you're standing in the queue with all your kids going, oh, how many centimetres were you when you had your epidural? Well, I got 6. Oh, you only got to 5. I'm much better than you. Like,
It's not. That's right. It's not a competition.
You do what you need to do.
Do you know?
for yourself.
I get that a lot. You know, people say, I do say something. This isn't a competition. If it was a competition, there'll be fair rules. Everybody have the same size baby, same contractions, same everything. But it isn't. Everyone's different, and the size of the baby is different. The key sometimes bigger than the lock. You know,
all of those little things.
All those things make a difference. You know, and you can't compare and contrast, and you can't. It's not a competition, and nobody's a winner, and nobody, unlike us, gets an A grade. So but some people do.
But everyone's a winner when they get that baby.
That's right.
And it doesn't matter how it comes out.
Exactly right. I think it matters less and less the further you get down
the further away from that
and it's like running the 400-metre hurdles, which I don't recommend to anybody. But
because you've never done it.
No, I couldn't do it. But if you do, as you approach that hurdle you're approaching is the most important thing. You jump that hurdle, you run a bit further. There's another hurdle.
That bit.
So then you've got your next hurdle in your life, and that's where and the hurdle behind you. It's kind of a distant memory, and it doesn't matter so much. And I think that's how we're programmed. We're programmed to the next hurdle,
And you can wish that you'd had something previous, because I know some girls, might have to have a forceps birth, or they might have to have a cesarean, and they really, really, really wanted to have that vaginal birth.
Yeah.
And I think if they can understand why they did it, for their safety reasons, or the damage that might have occurred to the baby or themselves. Then I think if they can understand that, then this is easier to reconcile.
Yeah.
Even though you might have wanted to, you want to experience. I know most girls want to experience, even though period pains are uncomfortable, and labour pains are even more uncomfortable. I think they still want to know.
Yeah.
And I can really see it. I know that sort of yearning to know what that feeling was like, to know if you can do it, which is bizarre.
Yeah. Well, look, I was just going to say about epidurals. That people have a tendency of turning them off when they need them the most. And. That's always a bit of a shame, because you can still push, and people say, epidural slowed labour. They don't. Labours in your first labour, they do stop sometimes, and you just need a respark with the oxytocin drip, And
I think if they had it too early, maybe.
They can if you happen to, but if you're already in established labour, it's not going to stop your labour just from having an epidural. What does happen though in first-time labours is you get dysfunctional uterine contractility, and that's why you just need a bit of a drip to get going. But certainly in second labours and third labours, epidurals,
they just keep on going.
They do.
And some girls have it the second time.
Yeah.
Because they think, I know, I've done it once.
Yeah, no, that's right.
Oh, there's pain relief now.
Yeah, that's right. Well, exactly. So, but that's good. And that leads us quite nicely onto a phrase I heard a few years ago. It's called the orgasmic birth. Margaret Mary.
Let me tell you.
What are your feelings on that?
I can tell you, there was no feelings like that.
I don't know. I can
see. I've experienced with looking after many women, what their reactions are, and I can see that there's, with some women, like maybe if I think back, I don't think it at the time, like them, in the throes of getting pregnant.
Yeah.
I can imagine that that could be how they are themselves, but I don't know that the actual orgasm itself is the sensation many women get.
Do you know, that makes me feel so much better, because I felt like such a failure that these women weren't having orgasmic births.
Well, I think there's a feeling. I think what's the definition of an orgasm? Basically, it's obviously having a good time. So if some women feel that just the fact that they've birthed, then that to them could be like the ultimate. But I don't know whether the actual sensation of the whole process of an orgasm is quite the same as having a baby. There's many other things. Is that enough?
Yeah. I think we should leave it at that.
Let's leave it at that. It hurts too much to think.
Let you people go into labour be your own judges of that.
Yes, and do let us know.
All emails to Margaret Mary, not to me.
Correct.
That's fine.
I'll flick on your
And so just moving on to placental encapsulation. Now this is
fairly newish
newish
thing
that seems to rear its head all the time
lately.
And maybe it's where we are. Maybe it's the popularity with the celebrities doing it. What do you, look, my feelings on
I
this.
know your feelings on it, and I have misgivings only because I'd like to see a paper, and I know you've looked for some papers on it.
There aren't any papers on this.
So it's anecdotal.
Yeah, look, I'm all for things that make you feel good, okay? Yeah. And as long as it's safe. And when you take any drug in pregnancy, if you take something for sickness or something like that. These have been extensively tested, you know, so we know what the risks are. And I think with the placenta, I actually looked up to see what was the constituents of a placenta. What's it actually made of? You know, and you know it's made of tissue and stuff like that. But what's
protein?
actually in it?
What's protein?
Yeah, that's right. Protein. There's probably some carbohydrate in there. You know, there's iron, definitely iron in there because it's like the liver, you know. But it's also got estrogen in, and this is my concern: is that you know taking estrogens when you're breastfeeding is probably not the right thing to do, because when we give the pill, you can't take the estrogen-containing pill for contraception. So because it estrogenizes the babies, okay, and that's male and female babies. So I'm guessing you probably would cause some estrogenization if you're taking a bit of your placenta. My other concerns are that the placenta gets taken to a kitchen. I don't know where it's done.
I'm thinking there'd be maybe a nice kitchen.
Maybe nice.
Maybe a particular kitchen, maybe or an area.
Yeah, that's right. So it could be whatever kitchen it is, and you don't know whether they're being mixed or whether they're.
Yeah, look, you can assume that it's done under fairly rigorous.
You do, but the TGA is the Therapeutic Goods Authority here in Australia, you know, and when you try and produce a drug, there has to be strict guidelines, you know, and it costs $500,000 a year to have those strict guidelines put in place.
True. Yeah.
I'm sure those guidelines aren't there. You know, the TGA guidelines aren't in the kitchen. But I don't know whether it's full of bacteria, whether you know the transport from the hospital to the, you know, what are you actually taking? And I'm a bit sceptical about the whole thing. I know that some people say it reduces postnatal depression and it improves your iron levels. You know, and of course it will improve your iron levels. There's no doubt because it's full of iron. But so will a steak.
Yeah, true.
And, you know, and but you know. Yeah. I don't know what you feel.
I can see why women want to take it. It's because other women have told them that it's good, and it's anecdotal, and some anecdotal stuff is great. Like we know, I know enough stories from other midwives that these things actually can work in different areas. But is this? I don't know that I haven't heard enough back from other women that it's good.
Yeah, look, we've had a few done it, and I don't know if we've had very good feedback from that. You know,
I've had some of the girls who really, really, really want it to work. It'll work for them.
Well, there's the placebo effect. You see, and this is why you need a placebo randomised controlled trial to show placebo versus placenta.
And so, like, why? What makes someone want to do it? Is it because they're feeling like they're either like a little bit prone to perhaps prenatal, postnatal depression? Is it because they think that they're going to get low in iron, or are they already low in iron? Is it why do we feel as though we want to eat placentas? Like, where does that come from? Like, I know in the animal kingdom, don't they? David Attenborough, he's had them. You know,
do they eat them?
Well, I think I heard somewhere. I don't know how true it is, but you know, like some animals, pardon me, they eat their placentas so that then the carnivores don't know that they've been there. Right. So you know. That would make sense to me. But
is that the reason?
Well, that's what David Attenborough said.
Is that what David Attenborough... If David Attenborough said it...
He's English, remember?
He's English, that's right. If he said it, he knows what he's talking about.
But, you know, I'm sure I read that somewhere. So, but I don't know. Do cows eat their placentas?
I don't think so.
I don't know. But anyway, do we need to eat placentas? I'm just thinking...
Look, I don't think we do. I think in this day and age...
I just feel as though... I'm uncertain.
Yeah, look, I'm uncertain. Look,
I'll happily let someone else eat their placenta.
That's right.
But I'd like them to know why they're doing it.
I think at the end of the day, Margaret Mary, we're basically... I don't think there's any evidence either way at the moment.
I'd like to see some.
I'd be interested to see how people go with that. Too. You know, and see...
Someone might send it to us.
Don't bring us some placenta. Oh my God!
Don't bring placenta to taste.
Do you know? The cakes that some people make is maybe
put a bit
of placenta through it.
Like
that's why people feel so good.
Sucked in.
Anyway, just moving on swiftly. Just something that really comes from this. You know, Caesars always get a bad name. You know, and
true.
You know, 25% of women still in this country and around the world have Caesar for whatever reason. You know, and sometimes it's more than that, depending where you are. Sometimes it's less than that. Okay, but there's a big interest in babies born by cesarean more likely to have autism, to have all sorts of things, you know, gastrointestinal problems, stuff, you know, and this thing of vaginal seeding. Now,
it's another. Is it a newish thing? I don't know.
I think it probably is. I think they're saying that the bacteria is different, and certainly it will be different. You know, I think if you have vaginal birth, the bacteria are bowel the bowel bacteria
the bowel
in the vagina.
bacteria, I mean, it's very close together, that and that. Yeah.
So when you have a caesarean section, the skin bacteria is slightly different. There's Staph aureus, which is very different. And the initial colonisation there may be some changes, but within a couple of days, I'm sure...
That baby's got to be colonised.
It will be, I'm sure
with the parents. You know, we promote skin to skin.
Yeah.
You know, with the mother and the father, so that they get the flora from
It kind of amazed me, because we had a company come around who was selling probiotics for babies, you know, and they've just jumped on the bandwagon without significant evidence and are selling this product, you know, and I think it's a bit wrong of that to happen, you know, and people are all obviously worried. They don't want their kids to have peanut allergies and allergies to things, because, you know, they want them to enjoy their lives and make life easier, you know. But, you know, unfortunately, people do get that, and certainly they don't want the kids to have autism or be on the autistic spectrum. So whether that, I don't know if vaginal seeding is the answer to that or not.
Yeah, I don't know. I think my understanding is, I think going to the probiotics, I think there might be a place, you know, if babies have to go on antibiotics, then maybe the parents might feel a bit better using probiotics for that, because I think that can, you know, there's maybe a place, I think, for probiotics. I think the vaginal seeding I'm uncertain about, like... Vaginal seeding, you know, like...
just describe how you do it.
Yeah, thank you. I knew you were going to ask me to do it. But it's basically vaginal secretions.
Right.
And either you put it on it, like the woman has a pad, or they can put their fingers in their vagina and put it on the baby themselves, or a swab. I've had some girls ask me, and I'm happy to give them a swab if that's what they want to do, which is a little cotton bud. But they insert it in their vagina, wait until the baby's born, and either rub it on the baby's face or put it into the baby's mouth. Right. So I think if they really want to do it, if they want to do it something along those lines, maybe they could just put it on themselves for the baby. But then again, people looking after them and helping the baby breastfeed, obviously we want to wear gloves because we don't want that woman's vaginal exudate all over our hands. So I think, I'm uncertain too. I don't know how many babies are going to be affected.
Oh, look, as I said to my ladies, you know, I've got a study of 2.
Yeah.
One was born by vaginal birth, one's born by cesarean, and they're both fine. And they share the same taste in food. They you know, they have the same bowel sort of action, and they're very similar in build.
Yeah, I don't think you can blame allergies. Maybe gut stuff, but is that to do with the flora and the flora and fauna? Always called it. But if there's stuff from that, you know, from the mother, or is it stuff that they've got over the years from whatever they've eaten?
Exactly.
You know, just so many changes. It's getting into epigenetics and stuff. But, you know, is there so many other factors that come into it?
There are a huge number of factors. Now, I think blaming the mode of delivery at one point in your life is very difficult to sort of say, well, the baby's born by Caesar have this. And it seems to be this is all that's happening. And it's so negative towards that. And I don't think Caesar or vaginal birth is the factor that makes the difference.
Yeah, I agree. I
just think so multifactorial.
Yes.
I think there will be maybe a slight difference in them, very slight, if any. But the other factors of the pregnancy, the genetics, epigenetics, the way babies develop, the environment they're in, whether they're playing soil, or whether, you know, whatever it is that they do, all these factors have consequences later on in life, you know. And I
think if they want to do it, I'll give them a swab, or they can do it themselves. But
look, as a parent, as you know, you've got to make. There's
sometimes
not
there's
not a right or wrong answer, you know, and you've got to do what you think is right.
And maybe if there's peanut allergies or something in the family, or not necessarily that, but if there's gut issues, Crohn's, or you know, maybe you're going to do anything because it's not going to it's not going to hurt.
No, it won't.
Then
it won't hurt. It's just. Oh dear. But no, it's an interesting time. So, do you think there's anything else that we should really cover?
Probably, but
other things that we sometimes come across.
What do we come across?
We do have some fun in here, I must admit, you know, and we do get some strange questions.
I don't know. I think I can't think of anything straight off the top of my head. Placenta. I think. Even taking the placenta home. I think some girls do that.
They do.
Buried. I think in some cultures, buried under a tree or under.
They do. I think most trees die though.
So the dogs get it if they don't put it deep enough.
Well, that's right.
I think. Excuse me, but I think the Maori culture. I think they might put it under a new home. I think I've heard that somewhere. So I'm sure.
Is that to add to some?
I don't know. I think it's just a cultural thing, but that's what I've heard that.
Yeah,
so I think in some cultures it might be really significant to do something with it, to revere it, because it's done a pretty damn good job. But after that, we don't need it. It's
No,
done
look,
what it needs to do.
in the UK, there's now guidelines on people taking the placenta. And they have to
we've got them here now.
Yeah, you've got to start filling in these forms.
What are they going to do with them?
Well, that's
Are they going to sell them for placental cream?
Well,
I've used it. Look how beautiful I am.
Well, they do use a lot of animal placental stuff.
Deer placenta.
I don't think they use human ones. I'm not sure though.
I'm not sure. No.
Possibly.
Who knows?
No,
maybe.
Maybe it's the elixir of youth. You never know. The placenta gives you youth.
Maybe I need a few more placentas.
Maybe we should just store some and get you to. But look, I think that's about.
That's
pretty much covered most things that we were going to cover.
Yeah, most things.
For the next podcast, we're going to be talking to, and Margaret Mary will be here as well. We haven't got any change of clothes, so we're going to talk to Beck, our psychologist, who we got here 18 months ago, but we'll talk more to Beck about what she sees and who she sees and how she can help people who are struggling in pregnancy. But thanks again, Margaret Mary,
Pleasure.
especially on your day off. I'm not paying you for this, by the way, so that's all good.
Double billed.
All right.